Welcome back to our clinical skills series. Today, we diving deep into one of the most fundamental parts of a patient consultation, taking the general and personal history. It's more than just collecting data. It's about building a human connection and uncovering crucial clues about your patient's health. Let's get started. The first step is always the simplest, yet most important. Get the basics right. Hello, I'm one of the doctors here. Could you please tell me your full name and age? This initial exchange isn't just for records. It immediately establishes rapport and helps the patient feel more at ease. A patient's age is our first diagnostic clue. Certain conditions are more common at different life stages. For example, rheumatic fever often presents in childhood, while conditions like atherosclerosis are more prevalent in older adults. Next, we note the patient's sex. This isn't just a demographic detail. It guides our diagnostic thinking towards sex-specific or sex-predominant conditions. For instance, in female patients, we might consider conditions like systemic lupus erythematosus or myxedema. In male patients, we might have a higher index of suspicion for things like COPD or coronary artery disease, especially if other risk factors are present. Now, let's talk about occupation. Asking, "What do you do for a living?" can reveal significant environmental and occupational exposures. Think about a glass worker who might be exposed to silica dust, increasing their risk for silicosis. A farmer could be exposed to pesticides or zoonotic diseases. Someone working with batteries or old paint might have lead exposure, which can lead to a type of hemolytic anemia. Each job tells a story and points to potential health risks. Marital status and family details also provide valuable context. Are you married? Do you have any children? This isn't about being nosy. It helps us understand the patient's social support system, which is vital for recovery and managing chronic illness. For female patients, this naturally leads to a more detailed history. We'll ask about menstrual cycles, pregnancies, breastfeeding, and contraceptive use. These factors have a huge impact on a woman's overall health and can be linked to various gynecological and endocrine conditions. Where a person lives can also be a key piece of the puzzle. A patient's residence can give us clues about their socioeconomic status, potential environmental exposures in their neighborhood, and access to healthcare. Certain areas may have higher rates of specific infectious diseases or chronic conditions due to local factors. Finally, we must sensitively inquire about habits. This is a crucial, yet delicate part of the history. We ask about smoking, alcohol, and the use of other substances. For smokers, we calculate the smoking index by multiplying the number of packs smoked per day by the number of years they've smoked. A high index significantly raises the risk for diseases like bronchogenic carcinoma and COPD. When asking about alcohol, be specific and non-judgmental. Do you drink alcohol? If so, how much and how often? Chronic heavy drinking is linked to a host of problems, including liver cirrhosis, pancreatitis, and cardiomyopathy. We should also ask about other substances like cannabis or opioids, as they carry their own set of health risks and can interact with prescribed medications. By carefully and compassionately gathering this personal history, we're not just filling out a form. We are piecing together a comprehensive picture of our patient's life, which is essential for accurate diagnosis and effective treatment. It's the art of medicine in action. Thanks for watching this episode on clinical history taking. We hope you found it helpful. Remember to like, subscribe, and hit that notification bell for more videos in our clinical skills series. See you next time.